Here to discuss the use of face masks in the school. Each person that would like to speak will come to the podium. You'll announce your name and where you're from. You'll be given 3 minutes. Officer Jordan will be keeping time, and he'll let you know when your time is up. And he's in charge so far as that is concerned. We appreciate y'all being here. We appreciate Sheriff Campbell and Officer Jordan being here. And with that, we'll begin. Officer Jordan, anything you'd like to say?
Yes, we want to be reminded that this is a dialogue. No decisions can be made tonight. They will have to be made at a school board meeting. So we want to try to be as respectful as possible to one another, to our board, to our whoever you're addressing. And like Mr. Felton said, it's 3 minutes, but we're going to have an open dialogue, ask them questions, and if they can't answer them, they'll get back with you. And I'm quite sure that we can trust our board to do that. Okay? Thank you.
All right, Dr. Williams.
I'm going to remove my mask so that I can speak clearly to the audience and to the Board of Education. Just for a little background and a little information, in March of 2020, the worldwide COVID-19 pandemic resulted in a shutdown of public schools in North Carolina, with students receiving their education in a virtual remote setting. With the opening of school in August of 2020, North Carolina schools were given the option of how instruction would be delivered. Gates County Public Schools within the school year with virtual remote learning, Plan C, and then in the winter moved to Plan A for the elementary schools and Plan B for the middle and high schools. In August of 2021, Gates County Public Schools returned to full in-person learning. From the return to school in the winter of 2020 to the current date, the Gates County Board of Education has imposed a face mask mandate for all students and staff. I was tasked at the November 17th board meeting by the Board of Education to provide some information on COVID-19, the transmission rates, survey parents, employees, and deliver timely information to determine if face masks can be an optional issue for students and staff, or just keep the status quo mandate of face masks for all. If everything works real good, I have a speaker this evening by Zoom. It's Dr. Michael Joseph Smith. He's a medical doctor at Duke University School of Medicine, and he is current COVID-19 status. He will deliver current COVID-19 status and recommendations in regard to face masks and maintaining a safe school environment. I'll present the results of the survey that we submitted out to the parents and to the faculty and staff. And then I got Mr. Jeremy Wright, Director of Student Services, who will give the current county data from ARHS, NCD, HHS, quarantine process, and the difficulties if face mask mandate is changed or vice versa. Then we'll have public comments, comment from the Board of Education, and then Chairman Felton, you can close the forum up. So with that being said, Mr. Warren Curry is in charge of technology here for the county. Can you get Dr. Smith online and available? Right there he is. How you doing, Doc?
This is really funny. I have a blue shirt on. It looks orange. Can you guys see an orange shirt?
No. It looks like North Carolina blue. I know you're Duke University, but
okay. No, that's perfect. It's funny. For some reason on my screen it's orange. But anyway, in all seriousness, thank you so much. I have a couple of slides, and then happy to take any questions. But let me see if this works. Okay. And then can you all? Yeah. Okay. Cool. So you can see my PowerPoint here. I'll go ahead and start. Thank you for that introduction. So my name is Mike Smith. I'm a professor of pediatrics and an infectious disease doctor here at Duke University. And I'm part of the ABC Science Collaborative, which I'll tell you about very briefly. So ABC Science Collaborative is a program that pairs scientists and physicians both here at Duke and UNC, and really now across the country, with school and community leaders to help understand the most current and relevant information about COVID-19. And really, we have a few different goals, really three main goals. First is kind of what we call informing evidence-based decision-making. And that's talking to superintendents and teachers and working with local and national health departments to make the best decisions for keeping children in school safe. Our second goal is really education, delivering educational resources for all, and that's one of the reasons I'm here talking to you today. If you have questions about COVID in schools, I do encourage you to visit our website, abcsciencecollaborative.org. And then over here on the right is what we call advancing public health, or really the research initiatives that we've put together over the past 15 months. And I'll tell you a little bit about our research around masking before we open it up for questions. So the question that we typically answer is a simple one: do masks work? And our group has done three main studies to assess this question here in North Carolina. About a year ago, when North Carolina was still in Plan B, we worked with just over 10 districts who submitted data on what we call secondary infections. And all the slides I'm going to show today talk about, what we call our secondary infections. We know that children can acquire COVID in the community. We know that children can bring COVID into schools. But the key question is whether children can stay safe in school. And that's what we call secondary transmission. So in Plan B last fall, there were, among the schools that we worked with, over 3,000 cases of primary infection. In districts that were masked, there were only 32 cases of secondary infection, for a secondary attack rate of about 1%. Later in the winter, we partnered with more schools. And again, after that winter surge, districts that masked had rates still less than 1%. And then finally, as you may know, as a condition of opening, kind of for Plan A in the spring, all the open districts in the state needed to work with us and submit their data. So we have a much bigger group of children with more than 40,000 primary infections. And again, less than 400 infections that were acquired in the school. Again, suggesting that in the context of masking, transmission is less than 1% within the school setting. And this goes along with work that our partners in other parts of the country have done. You can see similar numbers for Utah, Wisconsin, and Nebraska. More to the point, when Delta happened, it was much, much more contagious virus. And here at Duke University Hospital, for example, we saw more children admitted with COVID in July and August than we have in the last year and a half. And if you look at this, the top line here is the percent of Delta in the region. This middle line here is COVID-19 infections acquired outside of school. And you can see from July 12th to August, these really skyrocketed. But in the schools, and these data are from public schools that contribute data to us and were open for summer school, even with Delta, the rate of transmission was very low. And based on this, we're very comfortable saying that masks, especially in children at this point who are not vaccinated, are the single most important thing you can do to reduce COVID in the school setting. These are more recent data from the last few months. And as you know, districts in North Carolina now are tasked with deciding on a monthly basis whether to make masks optional or not. And that's given us the opportunity to look at schools that had masks optional and those who didn't. And these are just two examples of real schools. Again, I can't tell you which districts they are because the data are confidential. But you can see here in school one with optional masking, over here on this right column, there were 15 cases per 1,000 children per week. When they went back to requiring masking, that number went way, way down to 0.6. And this separate second school, same thing, a significant decrease in number of secondary infections when you go from optional masking to required masking. And again, when you put these together, it's even more pronounced. So what we've seen, at least so far in fall 2021, is that the districts that opened with masking optional, most of them had to go back to requiring masking because of the number of secondary cases of quarantine. We also have some data on will children mask. This is kind of a busy slide, but I'll say they will. If people want to ask specific questions about these studies, we certainly can talk about them later. But masking in districts who work with us, well over 85 to 90%. Um, over the course of the year. And I'm a parent of two school-age children. My 11-year-old and 4-year-old wear masks, and we have no problem. So again, in addition to being safe at protecting COVID, the children really can tolerate it, and they do a good job with masking. And I think the last thing I'd like to share before we open this for questions is, what happens when you don't mask? And this is a real life story. Is published in MMWR, which is one of the journals of the Centers for Disease Control and Prevention. And it's a story of a symptomatic unvaccinated teacher who unmasked to read aloud in class despite requirements to mask while indoors. We had a lot of questions about ventilation in this classroom. The doors were open, the windows open, there was a HEPA filter, and there was 6 feet distancing between students. But the teacher was not masked. And despite that, despite the ventilation, there was a significant number of children who got infected. 12 of the 22 students tested positive. 6 of 18 students in a separate grade were positive and had the same genomic sequencing, meaning it was the same virus. And they brought it home. So there were 8 additional cases in parents and siblings of students in these 2 grades. So again, when you put this all together, I think our group has shown that masking works here in North Carolina. That's consistent with research from other parts of the country, including this study in California I just showed you. And I will say it is absolutely appropriate to have these discussions about when we can stop wearing masks. My personal concern is, with Thanksgiving travel, with this new Omicron variant, which seems to be more transmissible, that this might not be the best time to reduce masking. And I know vaccine is now available to 5 to 11-year-olds. My daughter, who's 11, has just received her second dose. And I think there's still a time where we still need to get more kids vaccinated before I'd be comfortable, at least, reducing masks. And the other thing I'll say is this is my opinion. It's supported by the data, but of course, I encourage you to have these discussions as a group, as a school board, and in conjunction with your Department of Public Health. So that's the extent of my slides, and I'll stop there and see what questions you all have.
Board of Education, do you have any questions for Dr. Smith? Audience, do you have any? You got to talk through this so he can hear you.
How you doing tonight, sir? My name is Michael Sheeline. I have 2
Well,
kids.
thank you.
How many more illnesses are kids subjected to by wearing masks multiple hours during the day?
So is the question, does wearing a mask increase your risk for other diseases or other infections or things like that? Just to make sure I understand.
You can frame it like that. That's fine.
Yeah. So there have been reports of things like, acne, for instance, if you have a mask on your face. And certainly that's something that can be treated easily. In terms of other, more serious conditions, there's not really been any evidence of that being the case. The other question that people have is, for younger children who are learning their social skills, what do you miss by not being able to kind of see people's mouths? And there was a nice study out last week that suggests that, with eye contact and people looking at you, that in terms of developmental issues, that's not really shown to be an issue. So I think as a group, there are some theoretical concerns about wearing masks that haven't really played out. And the other thing is, children with asthma and other respiratory conditions have not had any worse outcomes by wearing a mask all day. So I'm very comfortable saying that masking is safe, and certainly when you consider how well it works, very comfortable recommending masking.
Okay, I'd just like to say that my daughter comes home every day with a stuffy nose. She suffers headaches. She's lethargic. By the time the Sunday evening comes around, she's feeling better. She goes back to school. She feels miserable again. So there's a little bit of evidence for you, unless personal stories don't add up to statistics. But some more. So you say you work for Duke University and you're associated with the University of North Carolina. Did you know that the University of North Carolina started the research that pushed us forward towards gain of function on COVID? Did you know that? That gain of function research took place in the University of North Carolina. That's fact. The government information is out there. I didn't bring it with me today, but I could bring a lot of information, but I don't have time to do the work of public servants. But okay, another question for you. After the Omicron variant has ran its course over the next few months, when do you suggest we take masks off? If Omicron is not as widespread as some may expect, when do you suggest we take masks off?
Yeah, so first of all, thanks for the information about UNC. I think, we have to work with North Carolina DHHS to make that decision. I think there are a couple of things to consider. One is, what are the rates of COVID in the community, and what's the proportion of the community and students that are vaccinated? And once you get to below certain levels with those, and we'll have to see what those are. I would love to get my mask off. I'm totally with you on that.
Okay. Just on a personal level, I think what's going on is, as soon as people get complacent with the Delta and the Alpha, I don't know what the first one was, they will bring in another variant in order to keep masks on, in order to keep control. It's obvious. And can you explain to me, how do they determine if you have an Omicron variant or a Delta variant? Can you explain that to me? Because I've done a lot of research and no one has given that answer yet.
Yeah, so the Greek letters that you're talking about, alpha, beta, delta.
Yeah, I know about that. I'm talking about the virus specifically. How do they determine that the coronavirus that you personally are infected with is Omicron or Delta or whatever variant they're given in the name of?
Yeah, but I'll answer that question, sir. I was just going to say that the WHO, the World Health Organization, determines which ones are more serious and more dangerous based on sequencing. There's lots of sequencing that happens, and you can look at genetic differences in all the different types of viruses. So, other countries are better at that than we are in the United States. But at major medical centers, Duke does it here, the CDC does it in Atlanta. Basically, you sequence the virus and see how similar they are to each other, and if they all look the same way. Again, I don't want to kind of get into like microbiology talk, but basically, each type of variant has their own little signature in the way it looks, and if that's similar to what's currently in the community, then you'd say it's this variant. I would say right now in North Carolina and most of the United States, we're still seeing Delta, right now.
Well, I can say I've had COVID. I quarantined. It wasn't fun, but I made it through. It's comparable to a slight flu in my personal experience. It isn't dangerous enough to shut down our schools, put masks on our kids, stop our sports, stop our lunch system. It's not. This is a control grab. I could bring data that says the opposite of what you say, but my data would be suppressed. You work for the very establishment that has pushed this virus upon us. I hate to say it, but you do in one form or another. Parents are going to come speak. We all have our personal opinions. We all have our own children. We have our right to protect them and have our own opinions. So, you know, your data, what about the data from Florida that says that there are no mandates, there are no vaccine mandates, there are no mask mandates in their school, and they have the lowest case numbers of coronavirus of any of the states? You didn't point that out with your data. You pointed out majority states that are blue, states that are pushing for these mandates. That's the data you presented to us. Thank you.
Anybody else want to? Yeah, come on. I've got another person, Dr. Smith.
Thanks.
Good evening. I'm a junior in high school at Gates County High School, and we are required to wear masks all day long except for at lunch, and we are not allowed to go to the cafeteria to eat. So we have to sit next to each other, and for those 20 to 30 minutes, we are allowed to take our mask off and talk to each other just like normal, just like how it was before, you know, the pandemic. And there's no problem sitting next to each other and eating and talking, but as soon as those 30 minutes are over, the teacher acts like suddenly COVID's back and we have to put our masks right back on. Could you explain why that is, that we are allowed to take our masks off right next to each other, but as soon as lunch is over, we have to put it back on?
Yeah, well, so I was not involved in the creation of your cafeteria policies. All I can say is that we know lunch is one of the highest risk factors for spreading COVID. Are you eating inside or outside, or where are you eating?
We are eating inside of our classrooms currently.
In any distance at all?
No, sir, we just have to take our lunchbox out and sit at our desks, and we are across from each other, beside each other, and we're just talking. There's no, 6 feet apart. We are allowed to sit just like normal and eat our lunch, and it seems fine, but then, like, our teacher's fine with it, but as soon as, it's over, we have to put our masks right back on. I didn't know if there was any statistics you had on that about eating lunch, how that affects COVID.
Yeah, I mean, the statistics that we've seen is that lunch is a real high risk time for transmission, and I would say you guys are doing something right if you haven't had any disease spread in that setting. So I'd be happy to talk to your board and your schools about what you're doing right, and we should look into that and why it's working for you. That's all I can say. I will say in other districts have not been that lucky. The vast majority of COVID transmission occurs when people are when people are unmasked, and that tends to be around sports or when you're eating. So you're doing something right. And again, I've not been involved in the creation of your policy, so I can't comment specifically, but I'm glad that you haven't had any cases.
All right, thank you.
Thank you. Anybody else have any questions for Dr. Smith? Board? Yeah.
I do. Good evening, Dr. Smith. My name's Leslie Byram, and I serve on the Gates County School Board. In your slide presentation, you noted that only 26 cases were identified in the schools. Was that 26 cases statewide or in the 3 districts that you did your power presentation on?
I'm sorry, which slide are you referring to?
It's after the one less than 1%, and it's the purple one that had the 0 acquired in schools, and then you did a presentation of 26 where only 26 were identified in schools. Is that the 3 districts, or is that statewide?
A number that small would be within the three districts.
And what were the 3 districts that you did, because they're small numbers or participation?
Yeah, as you know, as part of contributing to the data, we didn't want to announce individual district names. So unfortunately, those are anonymous, so I can't tell you.
Oh, okay. Okay.
I mean, I can reach out to districts, and if they're comfortable sharing their information, I can have their superintendents reach out. But I don't know I don't know what they are.
Okay, thank you. I accept your comment.
I have someone else right here, Dr. Smith.
Hello, sir. I know you said that you cannot, my name is Marlene Drake. I have 2 children at Gates County School. I know you said you couldn't list the districts, but can you tell us if they are larger districts, medium-sized districts, small districts? Because I believe in the society we're in and the circumstances we're in, not one fits all for
Yep.
any circumstance. So
Yep.
comparing apples to apples is a better comparison. And I don't know what your comparison was to our district. And I'm just wondering if it's more like apples to oranges or apples to apples.
Yeah, so I will say when you look at when you look at the body of work that we've done, so certainly the large study from spring 2021 included all the districts in the state, so really representative of everybody. The first study that I talked about from last year, with the 10 districts, really ranged in size. It ranged from counties that were on the smaller side, from about 10,000, to larger kind of city districts that had almost 225,000. Most of the schools tended to be primarily communities where the students were mostly white. There were a couple of kind of urban and other districts where there was a mix of Hispanic and African American populations. And there was a fairly good mix of, again, some bigger urban districts and smaller districts. When we looked at variations in transmission based on all these demographic groups and the size of the district and the number of staff and students, we didn't really see any major differences that jumped out at us, for what that's worth.
Anyone else like to ask a question? Board of Education. Okay, Doc, really appreciate you zooming in with us this evening. It was some good information and some good dialogue here with our parents and board members, and I just want to say thank you.
Great. Thank you very much, everybody. I appreciate the work that you do to keep our kids safe. Thanks.
Board of Education, I'd like to present the results of the survey. Next slide, please. Next slide. Right there. Okay, let's keep it right there for a second. On November the 17th, surveys were distributed to Gates County school employees working in the classrooms and to parents to gauge the feelings, thoughts about face masks in school. The survey asked each respondent to select one of the 3 options. Radio button 1 was face masks should be optional for everyone. Radio button 2, all students and staff must wear face masks. And of course, radio button 3 was all students and staff who are unvaccinated must wear a face mask. Survey, something happened. The surveys were collected on Tuesday, November the 23rd, right before Thanksgiving. And the results with survey recipients of employees, surveys distributed 232, surveys returned 200, and the percent of surveys returned was 86%. I calculate, I don't know if we may have a little more students than 1435. I think that's pretty close. But the surveys that were returned were 586, and the percent of surveys returned were just 40.8%. Next slide, please. So the surveys indicated, as you can see from the television screen, employees, as far as mask optional, 39.5% employees would want mask optional, 50.5% wants mask for all, and of course, mask for unvaccinated is 10%. Of the parent surveys, the mask optional is 55.8%, mask for all is 37.4%, and mask for unvaccinated is 6.8%. And if you put them all together, it's 51.7% for mask optional, 40.7% mask for all, and 7.6% mask for unvaccinated. So when asked if optional masks were chosen for schools, would parents and employees feel comfortable with the decision of current safety mandates in place? And as you can see from the information calculated, respondents indicated that employees, yes, they'll feel pretty comfortable with optional mask at 53.2%, parents 52.5%, and all responses 52.7%. And in the no category, they wouldn't be comfortable. Employees were 46.8%, parents were 47.5%, and all responses were 47.3%. And so that's the results of the survey. That's all I have on that piece. But I do have up next, I have Mr. Wright, who can provide information that you ask of us about where is ARHS in the North Carolina Department of Health and Human Services. Mr. Wright. You have to tell him to click your slides. There you go.
All right, good afternoon, everybody. What I'm covering right now is, of course, many of you know, the Strong Schools Toolkit that is created by the Department of Health and Human Services for North Carolina with guidance from the CDC. The first part is pretty much what you already know. Their recommendation right now is that all individuals 2 and above wear masks, especially for those who are not fully vaccinated. Right now, our Gates County Policy 4231 requires all individuals, including students, employees, and visitors, regardless of vaccination status, to wear face coverings. Some of the questions asked, or that have been asked to me, is when can we start discussing, or when does the toolkit, the CDC, and the health department think that we can start having discussions about making masks optional? Their information that they give us is that we need to be in a moderate or low transmission level within our county. When I did this report, it was at Gates County, according to the CDC, Albemarle Regional Health Services was in the high community transmission level. That has changed. As of today, we have moved down a level into the substantial. Then you have your moderate, and then you have your low. They, of course, are saying at least 7 consecutive days. Once that happens in the moderate or low, conversations can be had about making mask optional. Of course, these are recommendations. They also are recommending that if you make mask optionals, you are only doing that for vaccinated individuals. And the CDC is saying that once they get into that low level, then is when conversations should begin about making masks optional for all individuals.
Okay.
As far as kind of the things that are going on in the school systems and things that we are required to do, this is not a recommendation, this is really a requirement that we are doing contact tracing within the school system. Any confirmed cases of COVID require contact tracing, having protocols in place so that if there is a positive individual at the school, whether that be a student or a teacher, that we're able to find out who that person may have been around. We have not had very many at all secondary infections for teachers or students. But again, those are some recommendations that everybody has access to. Once a decision is made to go optional mask or no mask, we still have to follow the contact tracing protocols that is required. So, and that is pretty much for anybody who, the only differences there are if somebody has already had COVID in the past 3 months or if they've been vaccinated. Just a little bit of information I don't have on the slide because somebody was asking questions. We started doing COVID testing within the school system at the end of August, which was optional for everybody. We have tested more than 600, 700 individuals in that time frame. We've had 55 students or adults that have been positive for COVID with the test that we've given. So, okay, next slide. Current numbers within the school, and again, this has changed a little bit from when I did this slideshow, when I created it, but numbers are, as you'll see, extremely low within the system. Gates County currently has 1 active case, Gates County High School, and they actually have 8 quarantined right now, and that is from possible exposures within the school. Central Middle School has 0 active cases, but they actually have 5 quarantined right now. T.S. Cooper has 1 active case, and there are 4 quarantined. Gatesville has 2 active cases, 4 quarantined. Buckland is 0 and 0. And then our staff, we have 1 that just happened recently, 1 active case, and there are 2 staff members in the school system quarantined at this time. The last thing I was asked to mention was the report that we had recently from North Carolina and other districts. As of not too long ago, there are 3 districts in the state of North Carolina that are mask optional. There are 2 others that are pending optional masks. I learned today that there's another one on the northeast side that will go optional masks. But for the majority, everybody near us in the northeast is mask required at this time. So, I think that's it. Anybody have any questions?
Okay, so now we're at the point of the forum here where there's dialogue or questions that you all would like to, speak to the board, and there's answers and responses, since this is a forum that they can give to you as well. So whoever would like to come up first, or what board member would like to speak first, the floor is totally yours. Here, young lady. Make sure you...
I'm Aubrey and I'm in 4th grade, and I have to wear a mask all day, and I can't do it because I have a hard time breathing in it. And we're usually, at the beginning of the school year, they said that we could take mask breaks, but now I'm noticing that we can't really take mask breaks because when I ask, they don't let me take them. So, my teacher said that I asked him if I could take a mask break, and he said that I couldn't because he didn't think that mask breaks would be good for us to do. So that was what they told me.
Thank you, young lady. Anybody else want to talk? Sheila? Can you fix that camera?
It's good. I'm short. Hey, y'all. Okay, so I appreciate Mr. Wright giving the numbers. Thank you. Mine are a little bit different than yours, but mine showed from 12/3, from the Gates County Public Schools website. It let me pull up like a PDF from all the case numbers from October, but there was no data information on there for November. So like him, mine are a little bit different. only, I think, technically 5 active cases, and that's throughout all 5 schools. But I did have a question about the quarantining protocol that we have in place. So I see more people are quarantined than there are an actual case, and I know we have to do contact tracing. And then also on the toolkit, it has one there, and I know he had it, you know, if you had COVID within the last 3 months. There was also something that I read on there today that stated if you had a positive antibodies test, that you did not have to be quarantined. But I know several parents here, including myself, have gotten calls from the nurse, and our child has had to quarantine if they have a headache. I have a preteen child. She's going to have a headache. She's at her growth state where she has female stuff. It's part of life. She wears a mask all day. She plays sports in the evening. At what point is this just a headache from exhaustion, or is this a headache because you truly have to have a symptom? Because I don't feel I should have to subject my child to having a negative COVID test every time she has a headache or a cough. Any answers on that? Nope. Okay. Next thing. So with the active cases, again, there are 6 active cases in Gates County. And if you looked at the Albemarle Regional Health Services website, we are the lowest number in all the counties that they track. I think majority of them were 10 and higher. So we're the lowest, and obviously 5 of them are from school, from the kids, and one student or one teacher. And I think in the last 14 days, it said 112 cases total out of 100,000 residents. That math doesn't make sense to me. I mean, I'm not a mathematician, but if you answer or if you look it up and you go back and you trace the numbers, it doesn't make sense to me for Gates County to have 112 confirmed cases, but yet we only have 6 right now. And the number was lower, and of course it's going to be higher. People travel for the holidays. But with that, I know we have this lovely new variant that they have suddenly poofed into existence, conspiracy theorists or not. But there's always going to be a new variant. There's always going to be a new one, because guess what? It's going to feed off every other germ that's out there. So do we continuously live in fear and put a muzzle on our kids and a mask on ourselves to live our life when the flu does the same thing, and the flu's just magically gone? I mean, that's not around anymore. But as far as tracking, do we also monitor with the schools the common cold that the kids get that they're now sent home for and have to quarantine for? Do we monitor strep throat? Because my 6th grader got it. She was home for 4 days. Do we monitor the flu? Pink eye? Those are all contagious diseases that our kids give to each other. Mind you, she got strep wearing a mask. She was the only one in the house to get it. They go to the same place. Our house, school, Mimi's. That's it. So I don't get it. And as far as the mask supposedly not causing more harm than good, I know we said that it doesn't, but my 5-year-old pre-K, I said something to you guys about this back in the summer. He's got asthma. I had to give him breathing treatments all week last week for every 4 hours because of his asthma, because of a cold that he got from school. That's just my 2 cents. Other question I have, I know we've now made it to where we can eat in the cafeteria with our friends. So again, we're taking our masks off to eat with the same people that we're in class with, the same people we see during the weekends where we don't wear a mask, same people we do sports with where masks are sometimes worn and they're sometimes not. But my next question would be, our students who play extracurricular activities, can they please use the lockers? She takes a cheer bag, a big duffel bag, a lunch box, and a book bag that she has to carry around to every room. Every room. And then I saw another cheerleader who had to leave tonight, and she's got band equipment that she has to carry with her. These babies are tiny. They need to use a locker. I mean, even the other babies that have heavy book bags, I mean, it's a wonder they don't have back issues. or complaining of a headache and back problems. So, anywho, y'all have a good evening.
Thank you, Ms. Parker. Anyone else want to, Ms. Sheila? Come on up.
I have a question. Y'all can hear me? I guess my question is for other administration that might be here. When it comes to testing for symptoms or whatnot with the whole quarantine question that Ms. Parker had, I was under the impression that it had to have the fever and other symptoms if they don't present with a fever. What is the policy on that?
So there's a very long list of symptoms. The fever does not have to be present when you are looking at the possibility of the quarantining, or at least asking for there's several different options. An alternative diagnosis from a doctor could be one. They don't necessarily have to be tested. There are other couple options in there as far as if you have been vaccinated or if you've had COVID within the past 3 months, but those are all recommendations that we have in the NC Toolkit. So honestly, there's a lot of them. They keep on adding them. The question was brought up as far as working on protocols. Supposedly the toolkit is about ready to come out with some updated changes to it. I'm hoping part of that is on as far as recommendations for quarantining, and that we can start reducing some of these things that are on that toolkit. So they're supposed to be updating any day now. I was hoping we had something by today, but they have still not. They're also looking at reducing the number of days of quarantine. That is supposed to be an upcoming update. We just haven't seen it yet.
Well, I know originally, I think when we first started school, it was a reduced number for quarantining. It was 3 days, or that was 3 days, you had to be apart, now it's back to 6. But I think it was a reduced number, but I do know Virginia Beach just mandated it today, they did a thing where their kids don't have to quarantine anymore.
Right.
But as far as it being vaccinated versus non-vaccinated issue, I don't think that that's okay, and I think you're going to lose a lot of students, and they're going to find other alternatives. And I also feel like if you do that and you push someone to do something they don't want to do, I mean, I'm a Christian, I'm not sure which y'all's religion believes, God, and God, and whatever. That has fetal cells in it, and use that to make that vaccine as like me supporting abortion. I'm sorry, I'm not going to do it, I'm not going to expect my children to do that. So it shouldn't be vaccinated versus unvaccinated, because then you're literally spreading us out even more.
Body with class.
I have another, go ahead, Sally.
No.
I was just going to ask, I have a friend who I know, her child has been out multiple times because he has asthma, and he does end up having to take a test. Is there, I am sure that there probably are some sort of historical thing going on there. So, I mean, I guess what I'm saying is, are we taking into consideration if a child has been out, say, 2 or 3 times and it has been a cold or something, do we every time require them to be tested? And if we do, can they be tested at school even if they did not sign the original form saying they can be tested?
Yes, they can sign up for that at any point.
So do they have to sign a form, or can they just get permission for that particular test?
They have to register online. So there's an online system that they can register with.
Okay.
As far as chronic illnesses, to be honest with you, we do look at a lot of those and just ask for a doctor's notes. I'm saying that, also saying that this has been a lot for our school nurses. Not making any excuses, but we try to do situations like that on a day-to-day basis. So a lot of times I'll get phone calls about chronic illnesses. So in most cases, when we get doctor's notes, then we take that into consideration.
Okay. And I think our numbers say that we are probably doing a good job for looking at that. I just wondered if there were some procedures or protocols in place for those repeat offenders like the headaches?
Mr. Wright, I have a question.
Not offenders, participants.
All three of my children are in school. Each of them are at the elementary or preschool level. All of them do have a cubby or an area for their things. Why are we not allowing lockers to be used if we, have sport teams or anything like that, if they're spread out or whatnot?
I think originally that conversation was just because of the gathering at the lockers and the social distancing piece. But again, I don't have any issues with going back and having more conversations about things that we can revisit.
I think that would be a great conversation to revisit.
Hello again.
Hello.
Y'all know my name by now. It's Michael Sheeline. I have 2 children in Gates County Schools, one in Central, one in Buckland. Like I said earlier, my daughter is forever living with a stuffy nose because of your policies. Not after tonight. She has headaches, she's tired. That's all from wearing a mask all day, multiple hours. You breathe in more carbon monoxide with a mask on than you do oxygen. You're depriving yourselves of oxygen right now. I hope everyone here understands that there's an information war. An information war that information is silenced or censored. Scientists, doctors, nurses, and victims silenced. Whether you believe it or not, it's true. That's the truth. People are getting hurt from these vaccines and wearing masks, and they're being disregarded. So my objective here tonight is to share some knowledge with everyone, some common sense. In my field of profession, I work in confined space. Whenever I enter a confined space, I must carry what's called an air monitor. That device measures the air quality of my environment. It can measure oxygen, CO2, lots of gases. An expensive tool we use in the field. Now, if I take this air monitor into a space and it goes off, that means get out of that space. If I take that same air monitor and stuck it under one of y'all's masks, it would go off in seconds. In seconds. Those are facts. That device I'm talking about is about $1,400. We get yelled at work all day for losing them. They're expensive. But we have to have it. It protects us. I could bring it in next time we have a meeting. Probably have to pull some strings up. If you test anyone here with a mask with that device, it's going to sound off. So why do we demand our kids wear one all day long while trying to learn, while trying to concentrate? It's not healthy. It's not smart. We don't need to do it no more to our children. No more. My children have worn masks to school for the last days today. The last days today. My children ain't come. I have 2 of them. They're not coming to school with a mask tomorrow. I'm sending them with a permission slip because I make those rules, not y'all. Their health's on me. If they die, they get sick, it's on me, not y'all. We can go down the avenue of suspending or separating or excluding my children, but rest assured, I'm willing to take this argument. I'm willing to take it, and I'll bring some of them with me. We'll put our money where our mouth is. We'll get a lawyer. Lawyers. I don't know. These are my kids. I want them healthy. The COVID vaccination has killed more people than all other vaccinations that are allowed for the last 42 years combined. Think about that. And they're still pushing it like it's safe. It's an information war, like I said earlier. Nobody stands to gain anything from wearing a mask. We need to improve our children's educational experience. That needs to start with taking off these masks, letting our children breathe again, letting them have sports together, letting them have lunch together, and stop penalizing them for the mistakes that we've allowed our society to make. Masks don't help. Thank you.
Hello, my name's Sabrina. I'm Sabrina Sheila, I'm Michael's wife. I just wanted to say that throughout all of this, since the whole thing has started, we do not practice mask at home. We have still had family gatherings. I have still worked. My husband has still worked. We have been around other children. We did get COVID in October, but that was the first time we had gotten it. And eventually, everyone will probably get it. You know, it's inevitable. I feel like continuing to keep the mask on our children is not good. I feel the same way that my husband does. As a mother, I feel probably more strongly just because, you know, mama bear, you know what I mean? My second grader comes home, and sometimes he won't take his mask off until I tell him to. And I feel like he is like already being conditioned to the fact that he feels like he has to wear one at all times, even at home. And he also gets headaches as well, as my daughter, but not as much as my daughter, because I kind of feel like it's maybe not as pushed as much in the elementary school. And I have spoke to some of the bus drivers. I don't know if any of them came tonight. I'm not sure, but they are also having a hard time keeping the kids with their mask on, which I would assume make it harder for them to drive, having to look in the mirror to see which kids, you know, for sake of them losing their job if they're not making the kids wear the mask. You know, I wasn't for it when it first began, but I decided, okay, well, you know, let's see how far this goes. But we're almost done with this school year. Well, halfway through it. I mean, he started kindergarten. He was only in kindergarten until March, so he hasn't even had a full year of school to experience what school was like without a mask, except for like, 6 months? And he's headed to the 3rd grade next year, and so he will have spent almost his whole time in elementary school wearing a mask. And I understand it's scary. It's scary for all of us. We don't know, you know, or we didn't know back then how awful it was going to be. But like everyone else says and feels, how long are we just going to continue? Is it going to be like this till the end of time? You know, and I know there's not many parents here that came to voice their opinions, but I feel like that even if it's just a few of us, we still matter, you know. And from looking at the numbers of the surveys, it was kind of 50-50, which I kind of thought that it would be. I don't feel like it's to the point where that a lot of people would be upset if we made them optional, but I feel like a lot of us would be upset if it was not made optional. And like I said, we have not practiced it except for at school. I don't wear one to the store. I clean houses. I go in elderly people's houses and clean them. I clean for people who just had babies. Or people who have small children, and I have not been asked to wear a mask in their home, and I'm in there, you know, cleaning their house, and they know that I have children that are in school that come home, and, you know, we all did get COVID, okay? Well, the kids were still wearing a mask, and they still got it, you know what I mean? So really, how much is it actually preventing? And they're still having to quarantine even if they're in contact with someone that is masked. So if we're still going to have to quarantine either way, what good is the mask actually doing if we're still going to have to do the same things with or without one? You know what I'm saying? Thank you.
Good evening. Thank you for having us here. And thank you for those that actually responded. I'm not about the statistics or other counties. I believe all of you here are here because you were voted in by the county, by the people, by us, by the residents, to speak for us, not to speak for the CDC, not to follow recommendations, not to follow the government, but to go by what we, the people of Gates County, are asking for. And looking at the poll, it looks like 51%, which is the majority, voted for mask optional. So I think that should speak for itself, regardless of what the neighbors are doing, what the state's doing, what the president's telling you, what the government is telling you, what the CDC is telling you. You should be listening to the parents, point blank. So thank you for those that actually listened and for those that responded. And I pray that your time is short in office if you do not listen to what the people have to say. And thank you.
Good evening. Like I said, I'm a junior in high school, but I'm also a college student. I take 6 classes in a 4-period, day. So I have like a very rigorous schedule. I need to do a lot of schoolwork and make my time useful. I have to wear my mask all day, and I find myself focusing more on my breathing than like my schoolwork. And it's hard to like focus on all of my classwork that I have to do for my professors and my high school teachers. I have had COVID. It was more like a flu. I felt better in 3 days, and I'm talking about a virus that has a 97 through 99.75 survival rate in the world. I just don't understand why we have to wear a mask if we are touching this cloth with our hands, with the germs that we do everything with. We set it down on the table with the germs on the table. We pick our mask back up with the germs that are on our hands, put it back on our face, and we're breathing the germs that we just, do our everyday life with, And how do we know that the masks that we are wearing are CDC approved? I've seen people wear a $1 bandana from Walmart as a mask, and we're talking about supposedly one of the most deadly viruses known to mankind. This is not just coming from me. This is coming from a lot of my peers and friends that I see every day. We talk about this a lot. They are too scared to not wear their mask because they don't want to get suspended, because if we are suspended, we get dropped from our college classes, which means we don't have the opportunity to graduate with our associate's degree like we are planning to. I have been around someone that had COVID at school a couple months ago, and I had COVID like 3 months, like less than 3 months, so I wasn't supposed to, quarantine, and I walked in my classroom, and my teacher would not let me step in the classroom. And I said, well, Mr. Hayes called us and gave me permission, since I had COVID less than 3 months ago, to walk in the classroom because I have no symptoms and I want to go to class. And she said, no, you need to go get tested. I missed 30 minutes of my first period class, and that is my health science class, and I plan on being a physical therapist. That is the most important class to me because I learn about different healthcare things, stuff like that. So it hurt me that I had to miss the most important class of my day. I do think masks should be optional because, obviously, if you want to protect yourself, you can do that, wear your mask. But as an American who wants to use my First Amendment rights, I believe that we should not have to wear masks if we don't want to. What's the point? The question I do have is, why are masks mandated if we have the smallest number of any of the counties? And why is COVID so important if we get to take our mask off during lunch and have our mask breaks? Why is it so important, but we get to take it off, during these 30 minutes that we have if COVID is so deadly? That's it. Thank you.
Any more comments or questions? Anything?
I will make one comment on what she said. You asked about the length of time that you had your mask off and what's going on. according to my understanding and understand, I'm like y'all, I'm getting so much information, I don't know who's right and who's wrong. And that's being as honest as I can be. But what my understanding is that the exposure of time is what has a big influence on whether we catch it or not. So the more we wear a mask, the less likely we are to catch it. Now, that's the math that I've been told, whether it's right or wrong. I'm just like y'all, I don't know. I'm at the mercy of people that claim they know, and I'm at the mercy of the experts. Now, who in here knows what it takes to be an expert? 5 minutes from home. That's all it takes. So I'm not trying to minimize what Dr. Smith said. I'm not trying to minimize anything, but the school board, we hear y'all. I promise you, we hear you. We sympathize with you. I hate a mask just as bad as y'all do. I promise you. But I got a wife that says if you're going with me, you're going to have a mask on. And she's in charge. So I wear a mask wherever I go, just like she tells me, just like she does. We have this toolkit that the state gives us. And they say, this is what you're to adhere to. I think Ms. Parker asked me at the last meeting, do you have anything that says you're not going to get money? That's not the exact word you use. But do your funds depend on us wearing masks? Directly, no. Indirectly, it probably does, because we're expected to adhere to this toolkit, Safe Schools toolkit, that the state gives us. That's supposed to be what governs our decision on the mask. And it's not what public opinion is. Do I care about public opinion? Sure I do. Each one of the 5 of us sincerely care about what y'all think. But we also care that we've got to educate your children and the things that y'all do not understand, and that and I'm not pointing the finger at y'all, I'm pointing the finger at the whole county. The thing that people do not understand is how short we are on teachers, and even shorter on substitutes. If we have an outbreak among the teachers, and we have teachers saying, I can't stand this, I'm getting out, who's going to teach you? And you can say, well, I volunteer, but I'm not qualified. I had a algebra teacher when I was a junior in high school. And every day she'd say, she was 5'4" in 3 directions, she'd say, I was made queen at Duke in 33. Every day, at the first of class, I was made queen at Duke in 33. But she didn't know algebra. She had to go get Ethel Perry to explain stuff to her, and then she couldn't bring it back to the class. So I left school unprepared, and that's what we don't want with your children. And that's what we're fighting. I mean, we hear y'all, we understand where you are, but we're trying to keep teachers in the schools and trying to keep them healthy so we can keep school going on. And I just want y'all to understand that. And not just the few that are cared enough to be here, but everybody that can needs to understand that. We're doing the best we can. We're listening to y'all and to anybody else that speaks. But when the fat lady sings, we have to adhere to this toolkit, because if we don't, Roy Cooper's going to have somebody down here saying, I know what's wrong. Why aren't y'all doing it? And if we have an outbreak and start losing teachers, we're going to be up to Famous Creek, and I don't know what the state's going to do for us. So we got some really big problems that we're looking at that I don't think everybody understands.
Well, I mean, I know y'all went over the budget a little bit last month. I'm not privy to all of that. I mean, I think one of the issues with you not being able to get any teachers is teacher pay. But that's across the board in every state, in every county, in every school district. You know, our teachers are one of the most valuable things that we have. We all learned that when we had to do virtual schooling last year. I don't think they get enough credit, I don't think they get enough help, and I don't think they get enough support. And that goes for cafeteria workers, bus drivers, any part that has to do with the school, even you all. But if Roy Cooper decides to bring his tail down here from up where he is on his high horse, I would love to speak with him, because guess what, maybe we want to be the minority. Maybe we want to be the change and be the difference, because we're a small little Gates County community, but the majority of us feel that it should be optional. Even the teachers agree. So if you have the teachers that want to leave because of it being optional, so I'm not going to wear my mask, but you can wear your mask. Your mask is supposed to work. So let me have the chance to not wear mine to see if yours truly works. My next thing is, we've done what everybody says. Let's do the math. Let's do this. Let's do that. This was supposed to be a 6-month thing. It was 2.5 years ago. It's been longer than that. And like she said, my kindergartner has been in a mask almost her whole school career. That's all she knows. She's the same. My second grader comes home from Cooper, and I have to be like, Natalie, baby, take your mask off. You're not at school anymore. She can be outside waiting for me to pick her up. The bus line, the people outside, putting our kids in our cars, they're outside. The adults take their mask off. You would think that common courtesy would be there to tell the children that are also sitting outside away from each other, maybe it's okay to take your mask off. It's common sense, guys. If I saw you in the store meeting, you were having a one-on-one conversation, and we were standing 2 feet from each other, would you put your mask on to talk to me? No, you wouldn't. Do you put your mask on to talk to your cousin that you see maybe twice a year? No, you don't. You don't know where the hell they've been. And I understand that you have to follow what you feel is right as a board. I get it. But that toolkit, and I've read it front, back, sideways, every time there's an update. I read that. I do. It is a recommendation. It's not law, just like we told you guys last time. We are the taxpayers in this county. And the only people that are here are the ones who are against doing the masks or having them be optional. I'm fine if the person next to me wants to wear a mask, if they want to get vaccinated, if they want to vaccinate their children. That's fine. That's on you, on your conscience, on your religion, on your choice. That is the whole point of being a U.S. citizen. It is your choice. And we cannot compare to neighborhood counties who have multiple high schools, multiple elementary schools, multiple middle schools. We're a small community. I don't care what Tom, Dick, and Harry are doing down the street. I care what I'm doing. I don't care what they're doing in Showan. I mean, hell, we play them in basketball. Guess what? Half of them don't wear a mask. Half the people that come watch the sports, they don't wear a mask. So is it really doing anything? No, y'all, it's not. It's not. I mean, look, common sense, guys. Common sense. And I know majority of y'all probably agree with us, but you have to go with what the minority says, and everybody has to be in cahoots. And I'm glad that y'all are hearing us. I'm glad that only a few of us keep coming out and speaking, and I feel like we are finally being heard. Just like the cafeteria thing, you know, you probably going in there to eat, literally sit aside, just as close as they are, eating their food, talking, carrying on, sharing cell phones, sharing food, doing this, that, and the other, high-fiving each other, going back to class, put your mask on. And my child has also been told that she couldn't take a mask break. She was not allowed to go out in the hallway and catch her breath. She wasn't allowed to do any of that. She has a 504 accommodation. Do I have to put that in there for her to be able to go out and breathe? I shouldn't have to. It's a constitutional right. So I pray that the county has some sense, and I also feel like the naysayers, the ones who say, no, mask our kids, no, vaccinate our kids. they talk big and bad online and on the internet, or against me, or emails, or whatever, but I never see them, and they never say it here, in front of y'all. It's just not done. So where are they at? Where's their input? On a piece of paper? On an email? I don't see them coming up here and talking to you guys with respect, trying to get some answers, trying to get some common ground. We understand that y'all have a tough job to do. I mean, I'll be here every time I can to fight and question and ask things that other parents and other teachers ask me to ask you guys. I think maybe moving the meetings to a little bit later time when more people would be able to get here would be a good thing. It's just thought. I can't say that would be accommodating for y'all. You know, I had to miss her game to come. And make other accommodations for her to be picked up, but I'm here. And it is disheartening. I'm going to speak because they're listening to me, and I'm not being disruptive and I'm not being rude. It is disheartening, like me and you talked earlier, it's disheartening to see the response that we're getting from the people that are so worried about their children and the communication from other parents. And even though the numbers were smaller, 500, I think, responses, did we look at to see how many of those people had multiple children in different schools? I know we were only supposed to send one response back. I sent all 3 of mine back because I didn't know if they were going to get counted correctly or not. I have 3 children in Gates County schools, so I'm not sure if that was done. I know you had to handle it on your own.
I counted every one of them with my thumb way up, turn them off.
Okay.
I have a question on the survey, because I followed the direction of one survey per household. And like she said, I don't know if you realize that some did only send back one because they have multiple children, and if that was in the count. And I realize that's a lot of work for you, and I appreciate it. I really do. I really appreciate every single one of you doing the job that you do, because it's a hard job. Every day, you have to take in consideration and bounce through these laws that keep changing second to second because of some federal government mandate that may or may not apply on the small scale, because they look at the big picture, not the small picture. And I appreciate every single one of you, and I appreciate your time and the fact that you had this open forum and gave us enough time to make accommodations to come up. I don't really have a question for you, but I want you to know that I think that as a parent, it really should be a household parent choice to do the math. Now, granted, would I send my child to school if I think they're sick? Heck, no. I'm going to go on the side of caution, keep them home, find out what's wrong, then adjust. And I think most parents would in the time that we're in, which means going back to the question, if a parent needs that mask to feel comfortable for their child to go to school, then by all means, let them do that. Support that. Let them make that choice for their family. I, as a person, don't like masks. I work in a field that did not give me an option to get the vaccination. It was either I get it or I don't have a job. I chose to get it. Did I want to? No. Would I have? No. Does my family's well-being depend on it? Yes. So, in that action, I do not believe that mandates in reference to vaccinations are something that should be required for our students. I know this is not the subject today, but it's just my opinion. And I appreciate you listening, and I appreciate everything you do for us as a company.
Hello, I'm Diana Kennedy. The two girls are my daughters. They're both Gates County students. I did not intend to speak tonight, but as a parent, I do want to let you know that it is my job to protect my children. And we've all had COVID. My whole family has. My husband actually has a lung condition where he may have to have a lung transplant. We do take it very seriously. And I was actually hospitalized. And anyhow, there's something to say about natural immunity as well. It's actually safer than a vaccine. It's been proven, but I think I've made my decision tonight. I'm not going to let my daughters wear a mask when they go back to school. You are our public servants, and we put you in charge, but we are the ones that put you in charge, and there's something to say about that. That's all I really have to say. I just, as a parent, I feel like my daughters stand up. I really need to speak on their behalf. I did not know about my daughter Aubrey, her teacher saying that she couldn't take a mask break. That infuriated me. And she was like, "Mama, can I say something?" I said, "Absolutely." I try to raise strong girls, but that's upsetting to me. And the survey was given, and I'd like to know, what are you going to do about the survey? If it says 50% of us, which I didn't fill out the other survey, so I'm wondering if the numbers are actually higher as far as people not wanting the masks, because I followed the rules like the other lady said. But I'm just curious as far as the survey, what are you going to do now? We've told you we don't want them. Are you now saying, because I heard the gentleman say that CDC is stating that now you can go without the mask as long as you're vaccinated? Well, that's not happening. I'm a Christian, and same thing, the fetal cells, I don't believe in that. So I'm just letting you know. My daughter Lauren is a straight A student. Aubrey is a straight A student. I appreciate Dr. Boone being here tonight. She's the principal. She's wonderful. And I love our teachers. I support them 100%. But we're the parents, and we're in charge of their health. And I really want you to consider that tonight. Something has to change. It's not just open discussion. Now we need to put our actions and our words in actions. So I appreciate your time.
How's everybody doing tonight?
Good, how are you?
All right, my name is Mickey Turner. I live here in the community. I have a 16-year-old at the high school, and I have a 11-year-old at the middle school. And I am a teacher in another county. And I started 2019, started getting used to a system, learned the system. All of a sudden COVID happened. Then I'm learning a new system, okay? Then we went through more things and I had to learn another system. So I'm going through a whole learning process too. The whole virtual thing really screwed with me because I'm a woodworking teacher. I work with my hands. How do you do that virtually? You don't. But anyway, just wanted to bring some points. I do research into things, and from what I saw, the survey we did, basically you only got a response from a third of the people you sent out the surveys to. But according to that, 51% said that they don't want masks. Or, want an option. That's all I'm asking for. I'm not asking to get rid of it. I'm asking to make it optional for the folks that the parents let us choose. Because it is our children. We have done research on the things, and I think it's best for us to make the decisions and not elected officials, is what it boils down to. So, we do pay the taxes, and the taxes is what pays for the elected officials. And I say that out of respect for everybody. It's a hard job I never realized how hard it was. I thought teachers were slackers till I got to be one and had to do it. And it's a lot of work involved in that. It's a lot of work doing what you guys do. But all things need to be considered. All we've seen, just like the man from Duke, everything he had to say was negative. Didn't seem like there was a whole lot of positive thrown in there, which, there's two sides to that need to be looked at with that. But that's all I really wanted to say was just I would like to see it go to option because I feel like that's what it should be. And thank y'all for your time.
Usually before, when we open up meetings, if I'm not mistaken, we usually pray. Am I right? Yes. That didn't happen today. And I think that before we leave, we need to do that.
I have a question.
Board of Education.
I see we do have some of the principals here this evening. I would like to ask each of you to comment and respond as to why your school, or if your school has the situation happening there about the mask break situation that has been brought up multiple times this evening, and what is your response to hearing concerned parents that your teachers are not allowing students to have mask breaks? Okay.
So, Dr. Wilson and the person is over to school and we have mass breaks. We have mass breaks on recess, we have mass breaks, right lunchtime, we have mass breaks during the day. It's just after mass breaks, you know that they are allowed to have mass breaks, but the students may not walk around the class when they have the mass breaks. They have to sit at their desk, it cannot be over 15 minutes long. And we do have mass breaks throughout the day. Thank you. Same thing for us. If the teachers are not doing math breaks, don't know why they don't have recess at the middle school, but during gym or PE, they don't wear masks. When they go to lunch, they don't wear masks. So, but they are given the opportunity to take a mask break if they ask.
Gil Hawkins, principal of Buckland Elementary School, and we do allow our children to have mask breaks. They are allowed to take the mask off when they're outside. They are allowed to, again, they can't walk around the classroom, but they are allowed to have the mask breaks as needed. We do have children that we do have medical conditions, and we do know that they need to have those mask breaks. So to my knowledge, a teacher has not said, no, you cannot. But if you're aware of that situation at my school, please let me know so we can address that situation. I mean, you know, I can't be everywhere. We understand that. I mean, but
Good evening. Good evening. I will just say that my teachers are supposed to be allowing mask breaks at TS Cooper. As far as I know, they are. But if they are not doing so, then it would be real helpful to me if you would let me know when they're not doing that. I know that our students, I think Aubrey can attest, they take their mask off outside and during lunch. And they are also supposed to be able to take their mask off at certain points during the day. So if that is not taking place, I apologize, but if you will call me and make me aware, I'm like Ms. Hawkins, I can't address it if I don't know, but I'm more than willing to, and I need names, because it's not all of the teachers, there might be certain ones, so Aubrey, come and tell me.
I'll just say it from here, I think about it. As one of the things she had said, already said, and I'm not trying to pick on you, you're a great principal, you enjoy you coming over there. But, I mean, and not everybody's saying anything. Did you hear, they can take their mask off in the room, but can't walk around. If you got a germ, it's airborne. If you walk around the room, they can walk and eat lunch and have the mask off, play, and go outside and play, and you know they're going to have contact with each other. Obviously, they're kids. And like I said last time I spoke at the school board meeting, I said those kids do not know the difference from a clean mask or dirty mask. They're always touching their face. As my daughter spoke earlier, it's irrelevant. If you want a mask, it should not be mandated. If you want a mask, so be it, have it, whatever. But that mask is not, like they've already spoken. People that wore the mask got that virus. I mean, obviously it's not helping. It hasn't cured it. We still did it. I mean, it's a virus. Everybody gets sick. We have a great God that built us with a great immune system. So, we need to keep that in, when we're thinking about this mask thing.
Board of Education, you have any other questions or you have any comments?
I think I have a question for
Yes, ma'am.
our parents that are here. What are we as a board to say to those parents who feel just as strongly as you that there need to be mandatory masks? What would be,
Come up here and speak. Come up here and speak.
but,
Let's hear what are their points for wanting the mask?
well, I think their points are protection. I will say, I'm really glad I've got 3 grandkids at Gatesville. 2 of them both, I think, were in the 4th grade class that does have an active case. None of their classrooms had to be quarantined. And I think that's probably because they were wearing the mask, because in the letter we got, it said that they had they had kept the mandatory distance and they had worn their mask as they were supposed to. I was really glad not to see that number of kids have to go out of school. I understand, and I do hear what you're saying, but I think one of the reasons our numbers is so low is that we do wear the mask. And I think there's a certain level of protection. It may not completely protect everyone in every case for anything, but I just want to know how I explain to someone who is as adamant as each of you.
Then they can wear the mask.
But, okay,
So
but,
if
but,
the mask protects you, then wear it. But I don't think it protects you. Then obviously don't protect you if you don't trust that.
but see, I think what I'm saying here is, I understand that, but children are young, especially our kids at the elementary school.
We shouldn't have to wear it. We were born with the nostrils and breathe fresh air. I'm not trying to be.
I know you're not, I know you. I understand that, and I do hear what all of y'all are saying. It's a real quandary.
So this is the other thing. As we sit here, this man, and no disrespect to anyone, but he has a cloth mask on, one has a medical looking mask, but there's no mask that, it was guaranteed that you had to wear a certain mask, and this mask helped, and it eliminated virus. But it isn't. You can wear anything.
I don't think it's going to eliminate it. I don't think we're going to see it be eliminated. I think we're going to be able to see it hopefully be controlled. I mean, I think this, and I get so upset, I think, when I hear people talk about we're violating rights and causing harm, because I look back and I don't see any of you that are going to drive drunk. I don't see any of you that are going to go into a restaurant without a shirt. I don't see many of you that are not going to stop at a stop sign. Those are things that you don't have to do. They infringe on your rights, just like many other things. That's why I have such a conundrum with this.
I think a lot of it's controlled.
But
and I'm not saying you in general. I'm not saying you in general.
I understand. I understand.
It's not that.
What was the point in the survey if you're not going to take what we're saying into consideration?
And I think you're right with that too.
We're upset because you're not listening to the parents.
We had 1/3 of the people respond to the survey.
We filled out one. We have 2 children that are in the school. Y'all told us to fill out one survey.
But see, that's what I'm saying. We ask everybody to fill out one, but you filled out 2. Ms. Parker filled out 3. Oh, you filled out 1. Ms. Parker filled out 3. I'm really not arguing with y'all. I'm just trying to talk about this. We didn't have enough. We need to have more people. I concur with exactly what you're saying. The people who want the mask need to speak also, because then I won't have to worry about it.
This is the other thing. The CDC has admitted that they oversampled on the people that had COVID. Some people had the flu, some people had just a common cold, but they were tested and said that they had COVID. So a lot of people didn't even have COVID because they're changing the test as of December the 31st to a new test where you're gonna have the flu back now, and then you'll get detected for COVID.
I'm sorry, say that again, I'm sorry.
I
They're
said
changing the
COVID
test.
The COVID test, the CDC admitted that they're oversampling it. When they sampled, you could have had the cold, you could have had the flu, but it all said that you had COVID. Because my daughter, my oldest one, I don't even know if she really had COVID. She was sick for 3 days. My wife had something, probably the flu really bad. She was bad off for 2 weeks. I go to the hospital twice, all this, dehydrated. But I don't know.
I got you.
Can I answer your question? that
Yes,
you
ma'am.
asked? And this is my personal opinion, I think the answer to the people who are adamant, and I mean adamant, about everybody has to wear a mask for safety. I would ask them, if you feel that strong, that everybody should wear a mask for safety, then are you also in the opinion that everybody should respond?
Good point.
And if you have not responded, then why should I take your adamant, absolutely everybody should wear a mask, over someone who took the time and the effort to make their voices heard?
Well, we did have that
I
in the
understand
thing.
that, but I'm saying that would be my
Okay,
answer
got you.
to them would be, did you respond? Then if they said yes, I responded. Then I would say, I understand your feelings. And this is again, me responding to someone who is adamant about the mask. This isn't me to you, but this
Gotcha.
is me saying the response to that. Then, do you feel so strongly that this is a mandate that needs to be here forever? And I would want to know that answer. And I would address each point from them on why this is so important to them. And really get to the root cause of why they feel that in the 2 years later, that we're still at a point where everyone needs to be.
I see Dr. Williams getting antsy, so I know I have to hurry up and be quiet.
I'm not anxious.
Wait, I need to reply if I can, and now you've made me forget what I was going to say. Oh, no, it was him. Mr. Wright gave us some figures tonight about our county being that it had gone from high to substantial. And with those figures, my intent as a board member, I'm still open, but my feeling at this point is that we need to have those figures go down. And I think that if I'm willing to commit. No, we don't need to have masks for 2 years unless we just can't be around, when the numbers are where they're supposed to be. No, not his numbers. Not his numbers, our numbers.
According to his research that just recently dropped to medium, according to what he presented today, or substantial. Again, I don't know, but what I'm understanding, and this is again my understanding, is that when the level drops to moderate, then at that point we can consider. Now, if there's a drastic change back up to high or whatever, then we need to revisit masks.
Yes.
So that, well, it is, but honestly, I can see where that is a reasonable request as long as there's a notice going out.
How long would it need to be? It's there for a day. I mean, you know, at some point, we gotta kind of back. And I also want to know, the ones who are so against masks being optional and they want masks to be worn, I want to see how they wear their masks, how their kids wear their masks all day long.
Okay.
And they go out in public, and do they wear masks for every single function that they do? Or is this just, I want my kid to wear a mask when they're at school?
Okay, I can only speak from personal mine wear a mask everywhere they go with me. So, okay, I'm going to be quiet now.
Can you? Okay, yeah.
Good evening.
Good evening.
I was just curious, did you guys have the people vote on wearing a mask at school, or did you guys just come up with that idea and all agree with it? Because the First Amendment says that the right of the people, or there's the right for the people peacefully to assemble and to petition the government for a redress or grievance, and that the people should be making the laws or the decisions and not Congress or the school board, because this is not a decision made by you guys, it's a decision made by us, and you guys are only supposed to be here to speak for us. That's all I have to say.
The student's name.
Good evening, board.
Good evening.
School board, school officials, sheriff, Deputy Jordan. It's an honor to be here. Ryan Smith, I've been living here 10 years, just retired military. Plan on staying here until I take a dirt nap. Love the county, love the people, love the teachers. We have 5 children, 3 currently in the school system. I just want to get back to the basics. Those gentlemen painted on the wall behind you, this is the land of the free, home of the brave. If you want to wear a mask, wear a mask. You don't want to wear a mask, don't wear a mask. You want to pull your kid out of school, pull your kid out of school. We are land of the free. We're the greatest nation in the world because people fought for freedom and my brothers and sisters died in combat. And we're sitting here fighting over a mask. If you're high risk, put a mask on, go get the vaccine. If you don't believe in the vaccine, don't get the vaccine. This is ridiculous. Like gentleman over there said earlier, if we go to unmasks, they're going to require you be vaccinated. When does it end? When does it end? Enough. Land of the free. Give people the choice. That's all I have. Thank you.
Okay. Thank you, both. Anybody else want to make a comment?
I do.
Yes, sir.
I actually had 3 parents to call me, and they had ranged from 3 to 4 students in the school system. I asked them to submit 3 or 4 based on the number of their children. My question is, the 1,435, is that the total population of students, or is that just the numbers that were passed out to parents?
I think that's the population of the students.
Because if that's the case, then if you have multiple families that have from 3 to, Mr. Smith just has 5, how many did you return back?
We got 2 sent home.
You got 2. So, so it could be that the numbers could sway different, or they could be, a total population could be a lot more for optional mask or not.
Possibly.
So,
Technically, you do math, 1435 divided by 500, 2.87. So technically, that's 3 kids per household, 2 kids per household is the change. Out of that many kids.
So you might have gotten a higher percentage of responses than you realize. And I realize that it's hard to do it when you're doing it yourself. But maybe instead of saying 1 per household, maybe we should have said, and this is just my opinion, respond for every child you have so we can get an accurate count of children per response. And that's just my personal opinion.
Because they're all in different houses. Or how many kids do you have, list your kids, and what school they went to on the survey?
That way you could get an accurate number.
I should have thought of that.
Or is any of that going to matter because of what, like Mr. Felton said? Due to the regulations that the state puts forward, is this whole thing that we did pretty much pointless because y'all are going to consider what the state wants and not what we want?
Because the state funding has to be there for you guys to be able to do
Everything.
everything. And we get that. But, I mean, I know that there's some history books and some stuff where public schools stay away from state funding. We've gone a different route, found other ways, because they see the value in the education they can provide for their kids in the community versus what the state tells them they have to do, and the government says. I can look that up, find that information out, y'all, but I remember reading a couple articles about it. Could be mountaineers type stuff, but you know.
Okay, any other comments or, okay, got somebody back here in the back. That's my Director of Testing and Accountability, Ms. Roundtree.
So I asked a question about, we start testing in January, and the state gave us all this leave with actual testing, and even though we had to test it in kind of accountability, so we asked about it for this year. And we know we're going out for the holiday in December, some concerns about us being around other people and all that stuff, and we have a high number of students who are out when we come back for testing, and my question was, what do we do, or how do we handle it? And they specifically said, you have a 5-day testing window, and you have another, 5-day makeup window. And I'm like, the kids are out 14 days. Right. And they didn't really seem to think that I thought kids were out 14 days. They're like, they don't care. And they're like, this is what the state has in place to do. So I'm just saying that, you know, if it comes and we got your student out, and they can't take the exam after a certain amount of days, then the exam rate goes to 0. It's just all I'm saying. That's one piece to be.
You're talking about maybe if they testing.
Just the same.
Last year, I think it was with the youth program, state testing for that. There was an issue where somebody did route or something. There was an issue with the forms or something being wrong or something last year.
That was not a state. I deal with state testing, the DOGs, DOCs, and NC check-ins to students. And they give us in 1 year. They were real flexible with it last year. I mean, we tested students all the way through the end of the school year, almost. It seemed like the testing was long, but they were flexible. They don't seem to be that flexible this year, all I'm saying. I don't know what would happen if a lot of counties in North Carolina did end up with a lot of students who were quarantined during that time. I don't know what happened. But they did hold us accountable and accountability this past school year. But their accountability model is there this year, and they're saying we test 5 days in January for this test, and we have students out. We have like 5 more days where we can actually test one makeup day, but then pass that. My question was what we do, and people said we got 5 days to test them, and then we got 5 days.
Now, I guess that would be a question for Mr. Wright, because when that comes to the quarantine time, you can't send it DOD, DOD ain't home, because then, no, you're fucking here.
No, and I just have to say, if we, and I don't know if we had 1 or 2 students that fell in that case and we could really petition and get them, versus if we had a whole group of students who are home from quarantine. That's all. That's just my comment, my statement. I can test and I want to test always the second semester when students are finished first semester. That's not so.
Thank you, Ms. Roundtree. Okay, Chairman Felton.
And again, we appreciate y'all being here. I'm sure we have a better understanding of where y'all sit. It ain't like I didn't understand before, but I do. And I hope y'all understand where we are, because we put a rock in a hard spot. And Dr. Williams, I think there are 2 things we need to do. The first is that we need to bring this conversation to Governor Cooper and the people in Raleigh for them to understand what we're up against and for them to tell us how we should be acting, since that's what we've really been being told for 2 years is this is what you need to do. And the other thing we need to do is we need to ask Governor Cooper If this group brings a lawsuit, where do we get the money from to fight it? I think they're two good questions. But because the money comes out of the school budget, and we don't have the money to do it. So I mean, we're between, as I said, we're between a rock and a hard spot, and I'm not trying to put it on y'all at all, but that's where we are.
It's not even just the school systems, you look at it, it's shipyards, everything.
All right, we understand you. We can sit here and beat this dog to death all night. We're not gonna get any further. Would anybody be offended by Officer Jordan offering a prayer to close this meeting and do forward?
I'll think about it, I pray you. Let us pray. Dear Heavenly Father, we thank you, Lord, for this opportunity given us, Lord, to come and discuss these issues, dear God. We just pray, dear God, that you would just lead our board, dear Heavenly Father, lead our parents, dear Heavenly Father, as we dialogue more into this situation, dear Heavenly Father. Lord, you know all, dear God, so we ask you, Lord, to guide us in our decision-making, dear Heavenly Father. And Lord, we ask you, dear Heavenly Father, to manifest your signs, miracles, and wonders in our lives, dear God. Lord, that we will know that you are the Christ, that you are the true and living God. Lord, we just thank you, Lord, for you being who you are. And so, Lord, we just ask you to speak to us individually, dear Heavenly Father, and direct us in the way that you will have us to go and the way that you will have us to think. We love you and we thank you. In the name of Jesus, I pray. Amen.
Amen.